Hi guys, this is Glen Stilson with Independence Training based out of Phoenix, Arizona, and I'm happy to be on the Hunting Widow podcast.
Hey guys, thanks for tuning in today. So if you can tell by the title of today's podcast, you can tell that now I'm starting to interview one man every month. This will kind of be a little bit different than what we've been doing, but I'm really excited for you to hear some stories and experiences from some of these gentlemen. On today's podcast, we have a little bit of interference. So I wanted to give you guys a quick disclaimer on that, as well as letting you know that not only is there an audio portion, but there is a video portion as well. So you can find that through the Hunting Widow Podcast YouTube page, or it's also on thehuntingwidowpodcast.com under Glen Stilson, and it's on his show notes. So get ready and enjoy.
How's it going, guys? Thanks for tuning in today. Really excited. So today we're actually doing a video, which we don't normally get to do. So today on the line is Mr. Glen Stilson, and I had the opportunity of meeting you, Glen, over at the Well-Armed Women's Conference, and you did a class about dirt medicine, and I was so intrigued about it that I said, can we get you on? And so you can share some of this info with my listeners. And here he is, ladies. He is going to be showing us some really cool things. So, Glen, how's it going?
It's going great. Fantastic day down here in Arizona.
Yeah, I'm kind of jealous that you're in Arizona because it's probably a lot warmer than where I am.
It is. This is the nice time of the year where people actually like to be in Arizona, as opposed to a couple months ago, or even just a month ago, where people are like, I can't believe it's still 95 or 100 degrees down there. Like, yeah, it sucks. But now it's, wintertime everywhere else is getting snow and super cold, and we can still wear shorts. So
that's true. I wish that I could be in shorts right now. That'd be fantastic. Instead, I'm in a long sleeve black shirt. I'm in sweatpants underneath here, and I even have slippers on right now because my feet have been that cold. And I think it's crazy when people are like wearing hardly anything to go trick-or-treating, or they'll actually be able to wear their costumes without bundling up underneath. And that doesn't work here. We have to bundle and bundle and bundle. My poor children were looking like stuffed pigs by the time we were done trick-or-treating last night.
Yeah, your kids look like flashers. They go up to the door to trick-or-treat, they unzip their coat, show everybody who they are, zip the coat back up, get the candy. Yeah.
It's very true. It is very true. So, Glen, first I want to start off with a little bit of background about you. When we talked previously, we had talked about you being a hunter and kind of enjoying the hunting side of things, but you were also part of the military. So let's kind of start, which one came first?
Hunting came first. That's how I grew up. My pops was my dad actually grew up in big game guide hunting camps up in Jackson Hole, Wyoming, which is where all my family's from. And so he obviously, as he had a son, just wanted to pass all that on to me. So I grew up hunting big game, small game, a little bit of everything. And so because my father, who's also a veteran and worked with canines in the military, he had a really great kind of medical background of growing up in hunting camps where you had to take care of yourself and you had to take care of your horses, and you had to, no help was coming, so to speak. And then, his experience in the military, which was based on some medicine as well. And so growing up, we would have to fix a lot of animals. We lived in a very rural place, and there was a lot of people out there with sheep and goats and horses and cows. It was 4-H FFA country, you know what I mean? And so there was tons of people out there with all kinds of livestock and animals and pets. And so anytime that they would get hurt, they would call my dad to go out typically and fix them up if they didn't want to call out the actual veterinarian if there wasn't a really big deal. And so I kind of got to see from a young age what it was like to heal a living creature, which was very interesting to me. Went to the military. I was not a medic or anything like that, but I saw the battlefield medicine side of things. These days everybody gets taught what's called the Combat Lifesaver Program, or CLS, which is basically stopping bleeding and starting breathing and trying to keep somebody alive until an actual medic gets there, or that person can be, exfilled off the battlefield or out of the battle space. So after getting out of the military, when I became a father, and that's really what kind of drove me into medicine. You know, I had all these base level understandings of medicine, but didn't really understand truly how to save somebody. I knew how to keep someone from dying in the next few minutes, but that was about it. So I got involved in wilderness first response and backcountry rescue, and did a lot of stuff in the outdoors, because that was my passion anyway, and that's kind of where I grew up. So that's where most of my medical background comes from, is dealing with people in austere environments, right? Environments that are less than optimal, and typically you're not going to have a lot of supplies, so you kind of have to improvise and make do.
Right. And you know, when you sit in on your dirt medicine class and you're learning about all this stuff, and you're sitting there, and like my mind gets completely blown every time. Because I don't know, I always think that somebody's going to be with me who's going to know what to do. Like, I always hope that that's the situation. But, you know, I'm sitting there in your class, and you go through the basics of things that you need, and basic training. And I'm CPR certified, you know, I'm first aid certified, and I would hope that I could jump forth and put forth the effort. But one thing that you and I had talked about as well is, how do you put all this stuff in your pack? Because there is no way to take all this stuff when you're so concerned about weight and things to carry. And, you know, so you and I kind of got to talk about that a little bit, and you were able to share some things with the other women that were there as well. So, you know, let's kind of, let me refer back to my notes here, because we have so much fun things that we can talk about. But let's kind of talk about the changes from when you first started learning about how to really handle a situation to where things are now, because there are major changes that have happened.
There have been some really, really heavy changes in the medical world, and a lot of them started in the military and have kind of found their way over to the civilian world, just because of the way that life-saving is thought of so very differently in both of those environments. So I would say that probably the biggest mental change that has happened is that nobody is coming, it's up to us, right? I think that that's probably the biggest mental change that's happened in the medical world, is that people have started to see that a lot of the death that's happening is preventable, and the idea of just waiting for 911 or waiting for professional EMS is typically going to be a really good recipe for dead bodies. You know, it's not really going to help you stay alive by waiting for 17 to 20 minutes. Now, the issue is most people work within the context of their own experience, right? And so most people's experience with 911 has been very minor. You know, they needed to call 911 for an emergency that was non-immediate life-threatening, what we call, emergent or expedient, right? So they have a vehicle accident. One, people might be bleeding, people might be hurt, you know, stuff might be cut open, but no one's going to die in the next 5 minutes, right? And so that's typically what most people's experience is. Then you have this other group of people in their experience, which is a smaller group. Their experience is people die within the next, 5 to 7 minutes. And they want to know, well, how do we stop this from happening? And more of that has started coming from the battlefield side of medicine and the kind of wilderness side of medicine, where we have to keep people alive. There is nobody else coming. If we show up, we're the ones. We're it. There's no OR. There's no ambulance. Even getting air on site and air evacuating somebody out is going to be a lengthy process. So I would say the mental change has been this thing. I got reaching the thing is where I never pontificate, speculate, assume, or guess, or Monday morning quarterback any situation that I was not involved in. You look at the fact that 500 people were wounded and 58 or something like that were killed in that situation. There were a lot of people there who put hands on to try to save, and some people who really did save other people's lives, which is awesome. Imagine for just a second if 2% of that crowd, just 2%, would have been armed, not with a firearm, because a firearm in that situation would have been pointless, but were armed with the knowledge of how to save a life and the tools with which to save a life. Just 2% would have been enough people to address every single one of those casualties. And by casualties, I mean both wounded and the dead. So how many of those dead could have been saved? I don't know. I haven't seen the fatality reports for all 58 of those people, but I'm willing to bet it was at least one. And if it's at least one, it could have been a mom, it could have been a son, it could have been someone's best friend. Wouldn't it be worth it? So I think that mental change is really starting to shift away from people going like, hey, someone's going to come to save us, to, you know what, maybe we need to save ourselves. So the concept of first responder has shifted from a professional application to an individual application. It's up to you and it's up to me to save our lives and the lives of the people we love, because no one's coming to save us.
So when you say
that's the big change.
Yeah, and when you say first responder, a couple of things come into mind just for me, because I would be afraid to be I would probably be in shock, to be 100% honest. Responding to shock is one of the hardest things for me. I saw someone choking not the other day, it was a couple years ago, but choking in a restaurant, and I was like, someone should probably go help her. Because I was like, I don't know what to do. I don't know how to go help this person. So when you say first responder, it's also, even if you have the knowledge, to actually respond, not necessarily be in that shock moment. Because that's what I think of, as being stuck in that shock and like, how do I help? What do I do? I mean, like, obviously I would hope that I'd be like, okay, let's just try and pack this because it's bleeding. And then things might try to kick in. But like when somebody's choking, I'm like, somebody want to get over there. So how do you move past that shock? Because that to me is the biggest thing, because I can't ever get past it.
Well, so you actually just mentioned something that's the exact answer to how you get through those things. And then what you said at the end, actually, you can't ever get past it, is actually not true, right? You can definitely get past it. And what you said earlier is the reason that maybe when you were seeing that person choking, you said, I was looking at him going, I don't really know what to do. Now, you admitted earlier that you're CPR certified, right? So in CPR, they teach about conscious choking, which is what you witnessed, a conscious choking, right? So
and I knew what to do at the time. Like, that's the crazy part, is like, I knew how to help her. I knew exactly what to do, but I was just sitting there like, somebody should really go help this lady.
Yeah. So it's what you've run into there is kind of it's the core of everything that we do as training. I've been in the training business now for almost a decade, and here's the reality of training. Here's what most people do. They go and they take a class on a topic. It could be concealed carry. It could be, the defensive application of a firearm of some type. It could be a CPR certification class. It could be wilderness survival, whatever it is. They go take one class, and then they never do anything with that information. They just let this information sit up here, but they never actually apply it. So they've never pressure tested it. One of the things that we really focus on in our training are the three elements of training, which are having a standard to work to, some way to measure that standard, and some way to pressure test that. Well, what usually happens in a class is no pressure testing. Nobody ever really gets pressure tested. So they go, okay, someone's conscious choking, they're standing up, they're still coughing, go over, encourage them to continue to cough. All right, they stop coughing, now we start back blows and abdominal thrusts, they go unconscious, now we start chest compressions to try to blow the thing out. So there's all these steps, right? And we learn the steps and we witness them, and maybe or maybe not, we get a little bit of hands-on training. If the training is really crappy, you're not going to get any hands-on stuff. If the training is good, you're going to get a lot of hands-on. You're going to get a full explanation. And so you go through this and you go, okay, cool. I understand on an intellectual level. I understand. But when it actually is time to go perform the skill, like you discovered, you're going, I kind of know what to do, but am I going to be 100% right? Is this really what needs to happen here? So a lot of it comes from confidence. And the confidence in your own competence is what leads people to be able to stay focused in an emergency. People are going to panic. You're going to panic. You're going to feel that panic rise up and go like, oh my gosh, that person's bleeding. Oh my gosh, that person's choking. What enables you to respond is the focus that you're going to have, because you truly understand what to do. Not that you were shown it one time, or that you saw it one time, or that maybe you did it one time, but that since that training, you've practiced and prepared to be able to do that thing, whatever that thing is that you went and trained. In this case, we're talking about the abdominal thrust, but in that situation, That's stuff I can review. That's stuff I can practice. That's stuff I can prepare for. So that in the end leads you to look over and go, all right, I know what to do here. Now there's a second element here that's really important as well. And that is understanding that this stuff really happens. The acceptance of the reality of emergencies into your own life has to be a major step in moving forward with any kind of training. I can show you all kinds of cool stuff with medicine or firearms or whatever, but that's not going to do you any good if you haven't personally accepted that stuff like that's a reality. You know, that happens to other people, but it never really happens to me. That happened in Vegas, but it didn't happen here in, you know, insert your small town here. You know, it didn't happen to me, so it's not really that realistic. So one, you have to get confidence and competence in the skill set so that you truly understand what to do. Then you have to practice it consistently. You have to pressure test it consistently and constantly. And then you have to sit down with yourself and have a serious conversation. I mean, to switch for a second into, you know, like a hunting environment, why do most people miss shooting in the field? Why when that big presents itself, do they blow that first shot? I mean, there is a reason. And do you know what it typically is?
Well, it's the panic of buck fever. It's that adrenaline rush that, oh my gosh, this is about to happen.
You got buck fever, right? And why did you get buck fever? For guys who have seen 100 big bucks, do they still get the same buck fever? Now, don't confuse buck fever with excitement. Do they still get excitement? Of course they still get excited. But did they get that same buck fever they did on their first buck?
I would say no, just because, you know, you build up a tolerance, right? Because that's kind of like what you're saying is you have to build up that tolerance to that kind of situation. Now, if you're hunting every season, I mean, obviously you're going to build up a tolerance to it, but you're still going to have the excitement. But I think you're right, that adrenaline buck fever portion is definitely going to be a little bit more kicked back.
And when do those hunters, you know, guys or gals, when do those hunters who have more experience in hunting, when do they get the true excitement? When does it really settle in? So they see the animal, they make the shot, and then following the shot, which one of those three sequences will say, when does the real excitement for them actually happen?
So I can only speak for me personally. It was after I saw my cow elk go down. As soon as she goes down, that you're like, wow, okay. And then getting back over there, you know, you're all like, it actually was real. It was real.
And so that's what we can refer to as parasympathetic response, right? It's something that happens after this kind of pressure tested situation. So one, we build up a tolerance to dealing with emergency situations by understanding how they go. Now, not everyone can go and insert themselves into emergency situations like a paramedic or a doctor or something like that. But what they can do is they can go out and they can pressure test the situation. So once they learn the information in a class, they can go out into the woods and they can practice. They can go out and practice in the dark. They can go out and practice when it's hot. You could go outside and practice right now when it's really cold. How does the cold affect you? Let's find out. How does the heat affect you? Let's find out. What happens when you put on all the layers to be warm? How is that going to affect your performance when you're out there working on someone else who's wearing 4 or 5 layers to stay warm? Versus how are you going to be affected when you're down here in Arizona, you know, dealing with people in shorts, laying on hot asphalt, stuff like that? How's that going to affect us? So the only going to find the answers to those problems by going out and pressure testing the knowledge that you have. You'll also find holes in your knowledge by doing that. Like you'll run into a situation where you go, I don't know what to do here. The appropriate response during training then is to find out, either learn from, you know, someone who's teaching you, or go out and seek out the information. Make sure it's good, well-vetted information, but go out and seek out that information so that you know now, you know, what to do. Now that's the mental aspect, you know. So then your question of, okay, so, you know, how do you prepare yourself for the situation? Well, now you got to look at the tool aspect. All right. So we kind of talked about the mental aspect. Now we got to talk about the tool aspect. So what is another reason that hunters often miss in the field? Why do they miss?
Well, the only thing that comes to mind is like an inaccurate sight, or not knowing how to use the.
What can change your sight or your zero?
Practice. Making sure that it's on.
Elements. Well, it's like understanding your tools and how they work, right? So let's say down here in Phoenix, we're like 1,300 feet above sea level, nothing impressive. And someone goes to one of our local ranges and they zero their gun, let's say in late September for a mid-October, early October cow elk hunt. All right. So they're down here, they're 13 feet above sea level. It's really, really hot. It's 95 degrees, 100 degrees, maybe still at that time. And they get a good zero from a bench. All right. So they're sitting at a nice, comfortable bench. They have a certain atmospheric situation they're shooting through, and they do their thing. Then they're going to go up to Flagstaff, Arizona, and they're going to hunt one of our early cow hunts. All right. Now they're at about 7,500 feet above sea level. The temperature is probably going to be more in the morning, probably about 45 or, maybe less. Right now up there, it's probably about 30 degrees. So let's say they're up there and, it's 35 degrees. They're at 7,000 feet above sea level, and they're no longer on a bench. Now they're propped up on a tree branch or a fence post or their backpack or something like that. All these conditions have now changed. The bullet isn't flying through the same atmospheric conditions, so that's going to affect its point of impact. And they're certainly not in the same type of environment that they're used to shooting in, so that's potentially going to affect their point of impact. Then they miss that shot, and they can't understand why. Man, I held this sight right on there, and I pressed the trigger in such a way that I felt like, I made the shot, but I totally missed. Why? Well, there's all these other factors that are at play against them that they're not even necessarily understanding, because they don't totally understand their tool. They understand the fundamentals of the tool. They get that when you put the round in, you line the sights up, you zero it, you press the trigger, bam, they get a hit. But they don't actually understand how the tool really, really works in their environment that they're taking it in. So now we have to look at those tools, right? So looking at tools, in the medical world, of course, we have to look at medical equipment. And to kind of go back and answer your other question while also answering this question, which is what are some of the major advances we've had? Well, when I went through Boy Scout first aid in the early 90s or something like that, right? The first time I went into Boy Scouts and there were, we were getting taught first aid. We were taught tourniquets as a last resort. We were taught how to improvise a tourniquet with a stick and a rag. We were taught to put pressure on, a chest wound. We were taught to do things that we know now actually don't work. We didn't know that they didn't work then. But based on stuff that we've discovered because of pressure testing these things in the field, primarily on a battlefield in this case, we now know what things work better and that there's better tools and better applications because we took those tools into an environment that was not like where we learned it. Where we learned it and where it was taught from was usually a clinical perspective. So people looked at it from this perspective of, I'm a doctor, I'm a nurse, I'm a paramedic, I work in a clinical environment. Things are sterile, things are clean, there's lots of people to help me, I have lots of tools, I got an ambulance full of stuff, I got an OR full of stuff, and I have access to all these things. So in a perfect, clean environment, I can do an improvised tourniquet and it'll probably work. The chances of me doing it and successfully is pretty good. Then we tried to take those same things, and because in what I refer to as Iraqistan, all right, because during the Iraqistan conflict, we had so many people spread throughout so many nasty environments, we tried those things, they didn't work, right? And men and women died because those things didn't work. And so then we brought that same information into the wilderness world, and they didn't work, and men and women died because they didn't work. And so then we said, oh, this isn't good because we have the knowledge but not the tools, so let's figure out the tools. So I would say that the tools have been a huge upgrade in that. And as far as, you asked what's changed, tourniquets, we now use pre-made tourniquets, and we carry pre-made tourniquets. And we know that tourniquets don't cause the loss of limb, and we know that tourniquets don't cause any long-standing, detrimental effects. And we know that tourniquets save lives. We absolutely know that tourniquets should be a first resort in any case of massive bleeding. We know that because we've taken that tool, we put it in enough environments that we know it works. And when I say we, I'm not just referring to independence training. I'm talking about the American College of Surgeons. I'm talking about NOLS. I'm talking about THWP. I'm talking about all the large organizations that record all this information from hundreds and hundreds of thousands of applications. So by we, I mean the medical world. We know that these things work. We know that pressure on a chest wound really just kind of helps them die faster, but doesn't really do anything. Instead, we should put an occlusive seal, a big sticker. Learned in the very brief class we had together, a giant sticker, right? You put a giant sticker, and if you don't have a sticker, you make a sticker, but you got to seal that hole up. And we know that that's how we do things. And then there's all these other cool tools that we've figured out and found that we can use in the field. Things like needle decompression, which is how we get the air back out of the chest once we put a seal on. That was something that, a decade ago, was thought in the medical world, even not even just a decade ago, I mean, really only 4 or 5 years ago, was thought in the clinical medical world of being, oh my gosh, you should never do this in the field, to the fact that in 2000, I learned how to do it in the field, and I was, an 18-year-old kid. So you see my point? Like, there's this huge shift of medical concepts as we work from more of the field and clinical kind of start to meet. You get this huge shift in medical concepts. So tools, I say, are a huge factor in understanding how they really work in the environment you're going to be in. In a basic first aid class, yeah, doing something on the carpeted floor of a 75-degree room is going to work 100% of the time, typically. Right? But when you're trying to do it on your best friend or your kid or your loved one or your spouse in the middle of a rainstorm on the side of a mountain during a bad hunt that went worse, it's not going to work, unless you truly understand how it's supposed to be done and you have the appropriate tools. So I would kind of look at it from both a mental and physical aspect, that way.
Yeah, and you have some tools that you're going to show us, which I'm really excited about, because there were some things that you had showed at this class that I was like, I need this in my life, like now. But something I also kind of want to kick back on is you're talking about, helping people in the field. When people think about CPR, for example,
Right.
It was 32 compressions to 2 breaths. And right, am I correct on that?
30 to 2, yeah.
Yeah, okay. So so when I went and did my CPR class like a year ago, they told me that unless you have a breath, like a seal for the mouth, or this person extremely well and you're okay with putting your mouth on theirs, to just don't worry about the breaths and just keep doing compressions, because believe it or not, when you're doing the doing the compressions, you're automatically pushing on the heart and lungs. You're getting oxygen into the body. Is that seem about correct?
Yeah, it's compressions only. Don't worry about rescue breaths. They're a waste of time.
Okay, see, I wanted to make sure that I was on the same page, because I wouldn't do it to anybody unless it was my child or my husband, maybe my mother and my sister.
You know where that information came from? Dirt medicine.
I figured.
I mean, the idea of chest compressions, again, so much of what we do now, even in the clinical world, comes from the dirt medicine world. So it's that whole idea of chest compressions only is something that we've been doing in the field for a long, long time, because we knew that it worked. We knew that rescue breaths didn't necessarily do anything, and the primary goal was to keep oxygenated blood circulating to the brain. And you have about 7 minutes of oxygenated blood in your body at any time. So if we can keep doing chest compressions and we can keep the pressure of the hydraulic pump up so that we can circulate that hydraulic fluid through the hydraulic hoses, the blood to the arteries, then we can keep brain alive, which is the most important thing to do. Stopping to do rescue breaths not only decreases the pressure in the system, but also doesn't necessarily do anything with doing rescue breaths. You typically don't have a very good seal around the mouth. You are exhaling a significant amount of oxygen, but most people are either underblowing or overblowing. They're not necessarily always putting it into the lungs. Sometimes they're blowing too hard, and now a lot of it's bypassing and going to the stomach. There's a total waste of time, right? And what they found was, on a national average, the old CPR was about a 4% save rate. So 30 to 2 averaged 4% by bystander CPR. Nowadays, with chest compressions only, the national average hovers around 40%. So from 4 to 40 is a pretty significant shift. And there's some cities in the country that do an even better job of training their people, and some organizations that do a better job of training their people, and they have an even higher save rate. I think Seattle's the highest at like 52% or something crazy like that. So that's a massive, massive shift. Again, that information really came from the concept of dirt medicine, and some really awesome trauma doctors actually started really heavily here in Arizona, that whole concept, because of the U of A trauma doctors who did a phenomenal job at finally getting out there and changing people's minds. So that is a perfect example of how knowledge has shifted over the years and has totally changed the way people think about doing things, and increases the save rate.
Well, that makes me happy, because that means I don't have to put my mouth on somebody else's.
Yeah,
I mean,
that was also a huge problem. Yeah, no one wants to put their mouth on somebody they don't know. That's gross.
Nope. There's a reason that I don't like swap and spit with other people. So I want to see some of these tools that you're going to show us today, because
sure,
I really want to share these with people because I think it's really important. And you were telling me that you keep a kit in your car. You have one that stays on you, one that stays with your pack. I mean, you have one everywhere. So kind of show me what you've got to show us today.
Okay. Before I do that, I want to preface what I'm about to show with tools with this, and that is training trumps tools. All right. It is always more important to get the training than to buy a kit. It's you see it in the hunting world, I know, because I've seen it in the hunting world as well, where people are like, I want to be successful on my hunt, so I need to go buy a bunch of stuff. All right. I need this awesome new rifle or this awesome new scope, or I missed, so it must be the gun, or my hunt was unsuccessful, so it must have been the equipment I had. Training is more important than the tools. So while I want to show you these tools, and obviously we're going to have a very brief amount of time to go over them, I really want to stress that training, good in-person training, not the YouTube university style of training, but actually going to a class and getting really good training from reputable organizations, I highly recommend that. A couple different ones that I would seek out. Obviously, Independence Training, my own company, is my first choice. And we travel all over the country, so you can certainly contact us and host us in your area and all that, or come to any of our classes locally. But other organizations throughout the country that I really trust and would recommend, Dark Angel Medical with Carrie Davis, a phenomenal organization, great instructor. Caleb Kazi down at Lone Star Medics is another great organization. Precision Tac Med, I can't remember their lead instructor's name, but Precision Tac Med would be a great organization to go with. And that would kind of cover, those four organizations would kind of cover everybody. Certainly, if you can get involved with any of the crisis application group run by Jay Paisley, a former special operations medic, phenomenal guy. So there's just some kind of things for your listeners to go look up and see where they can get good training, because I cannot stress enough how important it is to train with these tools. And I think we've talked about that a lot already. So let me grab a couple pieces of equipment here. I would say probably the first biggest innovative piece of equipment is this thing right here. This is the CAT tourniquet. Now, the CAT tourniquet came about many years ago and has been changed and upgraded significantly over the years. But I would definitely say that the CAT, and I'm saying it as CAT, CAT, which stands for Combat Application Tourniquet. This is a piece of equipment that was born on the battlefield. But the CAT tourniquet is probably the most widely used tourniquet in the whole world, by our military, by other people's militaries, by our law enforcement, by our standard responders, by first responders. It's the official tourniquet of the new Stop the Bleed campaign. If you're interested in that, go to stopthebleeding.org or stopthebleed.org. I can't remember which one it is right now. But that's part of the Department of Homeland Security and the White House Safety Council's Stop the Bleed campaign. So make sure you check that out. The CAT tourniquet is the official tourniquet of that. So again, I want to mention tourniquets don't cause limb loss. All right, if the limb is going to be lost, it's going to be lost. The application of the tourniquet is to prevent catastrophic hemorrhage or massive bleeding. You're going to identify massive hemorrhage by spurting, squirting, pooling, or soaking blood. A ton of blood is going to be coming out of the body. Now, tourniquets can only be used for extremity hemorrhage. So we're talking about arms and we're talking about legs. That's the only way we can utilize tourniquets in this application in the context of what we're going to do today. So tourniquets are always applied high and tight. The closer to the heart you can get them, the better you are. So on an arm, for example, you would want to get as close to the armpit as possible. So right here is where I'm going to put this thing. On the leg, you're going to go as close to the groin as possible, so as high up on the leg as you can possibly get. If the wound is on that location or higher up, such as in the groin or the hip, or in the armpit or inside the shoulder cavity or something like that, then we're going to use a different method called packing and bandaging. All right, but for the time being, we're going to talk about tourniquets. So with something like a CAT tourniquet, they're simple to employ, and the best thing about them is they're easy to use single-handed. So to kind of give it some distance here, I'll adjust my camera a little bit so everybody can see what I'm doing. So I can take this tourniquet, open it up, get it over the arm, pull it tight. Notice how I'm high and tight, as high on the limb as I can get. And I've got this thing as tight as I can possibly get it. The initial tightness of the CAT is one of its main failure points. People don't get it tight enough initially. I'm going to bring that Velcro all the way back here to this retaining clip. I'm going to rotate this windlass like a water valve. When the blood, we'll say, is spurting, squirting from here, or pooling, soaking from under my shirt, when the blood stops coming out, I stop turning the water valve. Now that I've got this thing locked into place, I'm going to take the strap and I'm going to put it through that retaining clip so that if it gets pulled on, it doesn't come loose. In a perfect world, after I was done with all other forms of treatment, I would go ahead and duct tape this thing in place. Now, the benefit of the cat is that it is incredibly easy and intuitive to put on. It's single-handed application. Kids can put it on, adults can put it on. It's a simple piece of equipment. You'll notice that it has some of the major features of a functional tourniquet. Now, I want to say this about tools. There's, like anything else, there's a lot of crap out there, and there's a lot of tools that are created specifically just to separate you from your money. There's an organization, or there's a reason that major organizations don't use these tools, and there's a lot of them for sale out there. I'm not necessarily going to call them out by name because there's probably too many to name, but here's what you're looking for in a good tourniquet. One, it must be at least a good tourniquet's going to be 1 inch wide. All right. Two, it must be intuitive and simple to put on single-handed. Without that, it is just going to struggle as a tourniquet. And three, it either needs to have a built-in windlass or have the capability to add a windlass. If your tourniquet doesn't have one of those three things, then it's not a good tourniquet. I don't care who sold it to you or how great they told you it was or whatever. In the context of their limited experience, it might be appropriate, but in the context of the experience that was used to design this thing, trust me, this thing is a much, much better option. There's a very similar tourniquet to this out there called the Soft T Wide. And the Soft T Wide is also a very, very good piece of equipment. I'll show one later when I take off my ankle kit that you recognized earlier. But I do carry a Soft T Wide because it packs smaller. But the Soft T Wide's another good application, or a good tourniquet, I mean. So the cat or the Soft T, specifically the Soft T Wide, are really good tourniquets. However, they are still a little bulky. You know, not massively bulky. They're about $35. You might be able to find them for less online, but be very careful about buying them online because, again, there's a lot of people out there looking to separate you from your money, and there's a lot of replica items, so they're not the real deal. Be very, very careful. Buy from distributors of, you know, official cats only. We highly recommend the Tactical Medic, thetacticalmedic.com. That's where we get all our supplies. We know that he's only going to sell the best stuff, so that would be a place I would recommend going. They come in both black and orange. I highly recommend getting orange because it's high visibility, and I like that in an emergency. Now, they are, you know, I wouldn't say expensive in comparison to what you're using them for, but they're definitely a little pricey if you're going to build a lot of kits. You know, $35 a tourniquet starts to add up pretty quickly. And they are a little bulky. Doing something like this on you may not be possible for you. So, another tourniquet that we recommend is something like this guy right here, the TK4. All right, the TK4 is much smaller. It's a lot more cost efficient. They're maybe 15 bucks or so. They're not as easy to put on one-handed, but they are wide enough. They are intuitive to put on. While single-handed application is possible, a little bit of a struggle, they are definitely intuitive, and you can add a windlass to these. They don't come with a pre-made windlass, but it's easy to add. And so for something as simple as such, like carrying a flashlight, or maybe if you're a concealed carry, you carry an extra weapon magazine or something like that, then that's something easy that you can apply as a windlass. And one of the biggest advantages of the TK4, because I'm sure a lot of your listeners out there are moms and dads, is that this will go small enough to go around even the smallest of arms or legs for kiddos. This doesn't always quite get there. Same thing if you're a pet lover, you've got some dogs. This may not, depending on the size of your dog, go around your dog's leg. This will. So that's, you know, a major advantage of this. I'm going to stand up and I'm going to put this around my leg so that it's a little bit easier for everybody to see. You can do this single-handed, and I'll show you how to prep it for single-handed application later. But let's say I've got pooling, soaking, spurting, squirting blood coming out of my leg, all right? Or I've cut myself under these kind of heavier canvas-type pants, and there's tons and tons of blood just pooling out. You take the TK4. I'm going to go high and tight, right? As high as I can get. Now, I need to mention if there's anything bulky in the pockets, like a phone or anything like that, you want to remove that. In an emergency, I'm not going to take the time to pull it out of the pocket. I'm just going to cut that pocket and remove the items. But I don't want those bulky items in there. So with the TK4, I'm going to put the strap through the one hook. Now, there's a TK4L that has a heavy carabiner on it that really helps in this process. And that's just an upgraded version of this. Then because, and this is kind of the intuitive part, I just stretch as tight as I can. And I just continue stretching and pulling as hard as I can, and it's working. All right? And I get it as tight as I can until I end up with just this hook. Now, for purposes of demonstration, I'm going to release it a little bit so you can see what you do with the hook. Basically, you just go back to the tourniquet, you take that hook, and you slide it underneath any part of the tourniquet that you can get that hook to go under. Now that thing's going to keep it in place. Trust me when I tell you, this thing is working phenomenally. My foot is going dead. So now that I've got this thing in place, like I would do with the cat after I had done all other levels of treatment, I would come back here and I would duct tape over the top of this. Now, as I mentioned before, any good tourniquet has the capability to add a windlass. And part of the problem with the TK4 is it relies on strength and dexterity, which I might be lacking, or if my kid or something is putting on, they might be lacking. So as I'm going around, I get one good strap going around. Then I take my windlass. I'm going to use this flashlight as an example, and it's handy because it's got a little clip on it. And I'm going to add a windlass to this, just like I kind of did, or the cat already has one built in. Now that I've got a strap over the top, I'm going to start twisting this, and that's going to apply a lot more pressure because it's slowly making that tourniquet tighter. Then I can bring this guy in, which is the remaining part of the tourniquet, and I can wrap it around that windlass. Blind myself. And then I can bring that hook back here, and I can go ahead and hook it in place. Now, as you can tell by the way that both the cat and the TK4 work, this is obviously less optimal than this. This is a much, much better option. But because this thing has the ability to add a windlass, it gives me that ability to do a couple of things. One, it gives me the ability to not have to rely on strength and dexterity to tighten something up, especially if I got a kid applying it or I'm hurt, I'm losing that strength and dexterity. Two, after the patient or casualty, or you, if you're the patient or casualty, after you've relaxed a little bit, time has passed after the injury, your muscles are going to relax, and that's going to relax the vessels and potentially cause more bleeding, right? Now that everything's relaxed. So it's nice to have that windlass to be able to grab onto and tighten up some more in the event that that starts happening, all right? So having that windlass is a critical
it's just
part. Making
my leg hurt. Like watching you do it right now, because I'm like, dude, my leg is like feeling numb and dead.
I think I've done it enough. I think I'm almost immune to the pain at this point. But so there's a couple of different options. Again, the cat or the soft T wide, and then the TK4. If you can't add a windlass to it, it's not a tourniquet. Period. No exceptions. That's not just me saying that. That's every certifying organization, to include the United States military and a handful of other organizations you might have heard of. So if it doesn't have, you can't add a windlass, it's not a tourniquet, no exceptions. It's got to be at least 1 inch wide, and it has to be intuitive and hopefully able to apply single-handed. I mentioned I was going to show this single-handed. To get this guy on single-handed, what I would do is go ahead and create a loop, and you usually pre-make this loop. So if this was what I was going to put in my own kit that I might be using on myself, I would pre-make a loop like that. So I'd just put the thing through the hook and then go ahead and fold it up as normal and put it in your kit. So that when you opened it up, you would basically hold on to the hook and that strap so that I could, for example, get it over my arm. Then the strap's already in the hook and I can just start wrapping. Because trying to get the hook and the thing around your arm while you're bleeding out in a hurry is not going to happen, right? But something I can do is go ahead and prep it. Now that's where the TK4L, which is the upgraded version of this, it actually has a carabiner on this end that you can latch this thing into so that it won't come out as easily as it would here. So, you know, if you're looking for that, the TK4L is a really good upgrade option for the TK4 tourniquet. So there's kind of tourniquets and an incredibly fast tourniquet lesson. But that was not instruction. That was more demonstration. But understand that is essentially how they work. Right?
Yeah.
So,
and,
so tourniquets are important.
Yeah, that's what I was gonna say. Is learning all about those is it's important. It's important.
Yeah, the carrying tourniquets, so the leading cause of preventable death amongst multiple different locations, both law enforcement and civilians and the wilderness areas and the military, the leading cause of preventable death is bleeding out. Bleed out because nobody knows how to stop them from bleeding. My wife had a friend that told her a story this past Sunday about how last week they had a family friend die actually up in your neck of the woods, up by Salt Lake City. There was a guy who died on the commuter train down there. He fell and hit his head really hard on something and was basically bleeding out. Now, that's obviously, you can't tourniquet that, but you can, apply direct pressure and all that kind of stuff. And nobody really knew what to do. And so he died. The chances are that somebody knew what to do, but they weren't confident in their ability because they never really pressure tested their skills. They sat through a basic first aid class, and watched a DVD or watched a patient, but they don't really have a lot of hands-on experience with that kind of stuff. So it's a bummer. Things like frustrating. When I hear deaths like that, that's incredibly frustrating to me because someone's grandpa died on the Salt Lake commuter train. And by the way, his 13-year-old grandson was with him. And he died because nobody took the time to teach that 13-year-old kid how to stop bleeding. And nobody else on that whole train. I mean, how much time do people take standing in line for a Starbucks? Or how much time do people take cruising Facebook? But yet nobody ever had time to go to a real trauma first aid class or a dirt medicine class. Very interesting. Frustrating, maybe a better term. But yeah, it gets to the point where once you've been exposed to this knowledge, if you don't do anything to further it and someone dies on your watch, that's on you. It's a responsibility we really have to start taking upon ourselves. No one's coming. It's up to us. We're here. We have to save ourselves. We have to save the people that we love. So the next thing, how much time we have left, Laura? And I'll plan accordingly.
We have about 15 minutes left. So whatever else you'd like to cover.
I'll go quick. All right. So what I'm going to do is we're going to go into, I'm going to move some stuff around here. I'm going to try maybe to switch my camera. I don't know if this is going to work. I hope it's going to work. Did it
Boom.
work?
Yeah.
Yes. Magic. All right, cool. So what I'm going to do here around is we're going to talk about what to do, other tools to carry once you're in a situation where now you need to stop the bleeding. Now, there's 3 things that we're going to look at doing here, stopping the bleeding. Thing number 1 is we're stopping the bleeding because it wasn't available or a tourniquet couldn't be used. So that's that junctional hemorrhage I mentioned earlier, up in the groin pelvis or up in the shoulder or neck area. We're stopping this bleeding because we've already applied a tourniquet and it didn't quite get the job done. And then potentially we're stopping the bleeding because it's just a normal bleed and it didn't necessarily need a tourniquet. Not all bleeding, of course, is going to need a tourniquet. Only the worst of bleeding is going to need a tourniquet. So things that you're going to need for this are really simple. You're definitely going to need some gauze. All of the basic gauze is $1. And you're definitely going to need an ace bandage. All right, like a 2-inch or greater ace bandage, which is like $1. So here we have $2 worth of supplies, and that's it. Out there, hemostatic gauze like Quick Clot or Celox, and those things are really great products. They can be had for as little as $10 and as much as $50, depending on how much you want in the package. Really great options, but they're not necessary. They just help things faster. So what I'm going to do here is going to take, in the real world, for me to apply enough pressure to stop the bleeding would probably take about 10 to 15 minutes. With Celox or Quick Clot, it can be done in as little as 60 to 120 seconds. So 1 to 2 minutes for hemostatics, 10 to 15 minutes for regular gauze. They both get the job done the same, just one of them works faster. So we're going to look at this wound here. I'm actually going to turn this around. All right. We're going to look at this wound and we're going to say this is our wound. All right. We've got a big, nasty cut. And then maybe this is a big, nasty cut on the leg. Now, we could take our tourniquet and maybe apply it here, right? A wound and toward the heart. Well, this was in a location where we couldn't get a tourniquet. Maybe, the groin and leg was right here and we just couldn't get that close enough. So now what we're going to do is we're going to take our gauze, and it typically comes in a roll or a small square package. And we're going to find the spot in the wound that we can start packing. Now, at this point, I have to mention One, this is about to be invasive, so very careful, obviously, understanding legal liability, performing medical concepts on people that you may not know, all right? And two, wear gloves on for demonstration, but light-colored nitrile gloves are your friend when it comes to putting your hands on stuff that is and not yours. Okay? So what we're gonna do is we're gonna start packing. So I'm gonna take the initial pack and I'm gonna shove it into the wound. Your patient ain't gonna dig this. Like a tourniquet, it hurts when it's done, all right? Now, in contrast to the wound itself, it may not be as bad, but they aren't necessarily gonna like this. And what we're gonna do is, I'm just gonna take this gauze, and what I do is I fold it over, but I kind of fold it over here. You can see on the video there, I'm folding it, so that I end up with about 3 times as much gauze as just putting it in individually. And you can shove it in with a finger or a thumb. Typically, I try to use my thumb because I've got a lot more gripping power in that when I'm packing a wound. Now this roll, any typical roll of gauze is about 12 feet or so of gauze. All right, so it's a significant amount of gauze, typically about 4 yards. Continue to pack until I'm either out of wound, out of gauze. In this case, I know how big this wound is because I've used this trainer a lot. So I'm going to run out of gauze before I run out of wound. But let's just say that we've packed the wound full of gauze left over. We can either go ahead and start wrapping and create that initial wrap. And in this case, it's enough to almost get around. Or something I prefer to do is, if I've got a pressure dressing like an ace bandage nearby, is go ahead and take the rest of that and just put it on top. Now that I've got this on the top, I need to hold direct pressure down on that wound. It's with regular gauze, again, could be as little as 30 seconds to 120 seconds with the quick clot or Celox. Just depends on the product you're using. Once I'm sure I've got the bleeding stopped because no more blood soaking through the gauze, maintaining that pressure, I'm going to take my pressure dressing. In this case, I'm just going to use a regular old ace bandage. Nothing special about this ace bandage. I'm going to start applying pressure to it. So I'm wrapping around. I'm keeping the bandage close to the wound so that I can maintain good pressure. A good way to tell bandage. So if I take this bandage here, and I hope you can see this on the video, right now you can kind of see my finger through the bandage. That means it's stretched tight enough. If it's not stretched tight enough, you won't be able to see my finger through the bandage. Stretch it tight enough, and you're back to seeing my finger through the bandage. So make sure you pull that thing nice and tight. This happens to be a white ace, but it's the same as any other ace you've got. Now, as your bandage, notice how I'm taking my time and I'm using the full width of the bandage. All right. So I've got this thing going around. It's nice and even. I'm applying nice, good pressure. And I keep going over the top, over the middle, over the bottom. I want to secure all the wounds. I want to secure everything I possibly can. Now I end up at the end. Now this particular ace bandage happens to have a Velcro ending, so I can literally just Velcro that thing. But to show you how to do it with the other bandage, just put them underneath the last roll, go around to the point where you can open up some space, pull that through, pull it tight, and you're in business.
Awesome.
Of it when given the opportunity. So there is how I'm going to essentially pack bandage for the most part. So gauze and bandage is better bandages out there like this guy here. This is called the emergency bandage, sometimes referred to as the Israeli bandage. The benefit of the Israeli is that it already has a big gauze pad built into it, and it also has this pressure clip. So I'm going to flop this thing around, and we'll say we've this full of gauze, right? This thing packed full of gauze. We can take this bandage, we can go over the top, directly over the wound. We make at least one big roll wrap here. Then we make at least another wrap. So we've got 2 wraps through the pressure clip. Then I pull backwards on that pressure clip, and that puts more pressure directly down on the wound. Continue to go around. I do the same thing that I did on the previous bandage, where I take my time to make sure that I really secure it, pulling it nice and tight. Now on the back of this one, it's got that nice plastic clip. Throw that clip in here. tape over the top of it when given the chance. I'm a big fan of duct tape and med kits. I can also do the same thing, and I kind of like to do it this way anyway, where I can take those and roll back around. Because what's cool about this guy, pressure before, I've got myself a windlass. I can go ahead and create pressure, and then when I'm done, to clip it into place and duct tape over it when appropriate. So, you know, these bandages here may be $4, something like that. So they're certainly not items. So when it comes to bleeding control, I would say that, you know, a bandage, gauze, some type of tourniquet, obviously very, very necessary.
So Glenn,
yes,
with your camera being flipped, we're getting a little bit of some distortion coming through.
Okay.
Let's flip your camera around and kind of show your ankle strap, like your ankle first aid kit, and then we'll wrap up.
Okay, cool. So, so bleeding control, I would say, you know, I'd love to get into breathing control. I don't think we have time for that, obviously, but breathing control is probably, or bleeding control, I mean, is probably the most important thing. So hopefully that came through. If it didn't, by the way, we do have a couple videos, I think, on our YouTube channel that show similar concepts. So there's a couple things you can do for kits. So as an example, here's something, I just dropped it, that I carry around my ankle. So this is my ankle first aid kit that's made from a company called Riker Nylon Gear. Also, you can buy these from the Tactical Medic. And so the benefit of the ankle kit is it fits around my ankle and it weighs nothing. It's very lightweight, but I can handle all of March with it. Now, March is what we consider to be the easy way to assess all patients and all wounds, and I'll break it down very quickly. March, M-A-R-C-H, is massive hemorrhage, airway, respirations, circulation, and hypothermia, or the treatment of shock. So a kit like this can handle all of that. I have my pressure bandage here that I just demonstrated. Here's my soft T wide tourniquet, similar to the cat. I do carry a pair of 5-inch shears. And then in this pouch, I have an emergency blanket for treatment of shock. I have hemostatic gauze, the stuff that helps to clot bleeding. I have a pack of duct tape. You can kind of see it here. And then I also have my pair of gloves. In the back here, through this back channel, I carry 2 occlusive seals, which are the stickers we mentioned earlier for covering up any kind of penetrating trauma from the neck to the belly button. So it's everything I need in one kit. Now, here's the advantage of a kit like this. Obviously, it works around my ankle, and it is TSA approved. I've flown all over the place with this thing and never been denied it, not even one time. Because it wraps up like this, right, I can throw it around the strap of a range bag. I can throw it over the shoulder strap of a backpack. I can throw it around the kidney pad of a backpack. Easy, you know, if you want to put it in a purse, just smash it flat. If you want to throw it in a backpack inside, if you want to throw it in the map pocket of your vehicle or put it in a console or a glove box or anything like that, it's a really easy thing to add to your life. You know, recently I was at the beach with my family. It was easy for me to take this, make it as tight as I could. I took my phone, shoved it in there, took my wallet, shoved it in there, and now that's everything I need. I set that over there with our towels, and sitting right there by our towels is everything I could possibly need for an emergency, right? In case we got to go get some snow cones, that's a real emergency, all right? Or in case, you know, I need to make a call, or in case I, you know, need actual, you know, trauma support because someone cut their foot on something really bad, or God forbid there was an animal attack or something like that. Someone got run over by one of the beach patrol people or whatever. I have that capability to respond. All right, so it's something I can literally take with me everywhere that I go. And, you know, a kit like this built up will cost you about $130. So, you know, if you get a kit, it's got everything I need in there to respond to both personal emergencies and emergencies on the people that I love. So pretty important. You can go as simple, like I put this kit together just to everybody. So this is a kit I just threw together with some supplies in our office here. An ACE bandage, an improvised tourniquet if I needed to use for pressure dressing. I've got a flat pack of duct tape in there, you can see, and a pair of gloves. $2, $3, $4, $5, $6. For $6 or maybe even $5, I put this thing together. I put it in a big, heavy-duty plastic bag that I could use as an occlusive seal, or at the very least to keep my stuff dry. Roll that thing up. And where can you not put that? I mean, that is something you could put in a bag, a backpack, a glove box, whatever, and it's everything you need. That's way more than a basic first aid kit could offer. You know, you've got even kits this small. This has the occlusive seals. It's got emergency blanket. It has a tourniquet. It has tape. It has a bandage. It has gloves. Literally everything you would need to handle March. We just talked about that size. Fits in any small bag, pouch. This is the kit that my wife carries around in her purse with her. Very, very small kit. Maybe they're 45 or 50 bucks. They're not that expensive, you know, set up like this. They're basically just vacuum sealed up. If you have a food saver in your life, which if you don't, get one. If you're a hunter, there's no reason for you to not have a food saver in your life, right? But get a food saver in your life, and worst case scenario, you can do this yourself. Buy the supplies, take them out of the package. You don't want to be fumbling around with a bunch of plastic packages out there in the field. Don't worry about sterility. We're talking about working in unsterile environments, so don't worry about that. Take everything out of the package, except for hemostatics. Don't take them out of the package. And, you know, freezer bag them into this. Slide them in the hydration pouch of your backpack, you know, when you're hunting. Slide them into your cargo pocket of your hunting pants. You know, you can make kits that are small enough like this to slide in the little kidney pad pocket on your backpack. Take something like this and put it around your ankle, or put it around the strap of the backpack. If you're going out hunting, there's no need. Now, to give you an example, this is my full wilderness outdoors pack, significantly larger than what I just showed you. You know, I guess not massively larger, but definitely in the broad scheme of things, it's bigger and a lot more to put into your pack, and certainly a lot heavier. But, you know, when I go into the backcountry, this is the kit I take. There's a lot of tools in here that are very job specific, and so my training and my experience allows me to utilize them. I'm not saying that you shouldn't carry those, but definitely don't carry stuff you don't know how to use. It's pointless. Yeah. But something like this, at least to get you pointed in the right direction. You know, kits like this are probably going to cost you, you know, a few $100s by the time you put all the components in, whereas kits like this are significantly less. So, and kits like this, I mean, good grief, $5. You want to do something cool? You got Christmas coming up. Instead of buying people a bunch of Chinese-made crap that they don't really want anyway, go ahead and get them this, right? A $5 kit, and then do them an even more solid present and get them the training to go along with it, and start training as a family, and start training as a couple, and start training as friends, or whatever your social group is. For $5, you can give a life-saving kit. Go up to 35, 40 bucks. You can put something like this together. 130 or so bucks. You know, maybe we'll call it 300 bucks or something like this. So start thinking about, you know, putting these kits together. It's not a lot. It's easy to carry. It really is. It doesn't take much to carry around stuff. You could take, you know, even if you're just wearing cargo pockets or something, you take an ace bandage and some gauze. That's simple to toss in a cargo pocket or a purse, and at least at that point, you have something, which is better than a basic first aid kit.
You guys, there's so much information here. I wish we could get to everything that Glen has to offer.
Yeah,
if you have any questions, if you have any questions, you know, we can put your email up. So if somebody wants to contact you and ask you questions, we can do that. We're going to tag the company as well through social media and on the show notes. So if you guys have any questions at all, please don't hesitate to ask. We want to make sure that you answer all your questions. Maybe we'll do a part 2 where it's a little bit more in depth. But I am so excited that we were able to share as much information with you in this little video for you that we've been able to. So Glen, thank you so much for coming on today and sharing just even a privilege.
Oh, you're very welcome. My pleasure, truly.
Yeah, I'm so excited to see where you go in the future, and I'm super excited to see what we can come up with next.
Awesome. Thank you so much, Laura.
Thanks again, guys, for tuning in today. We want to bring you the best content we can. Is there someone you want to hear from or a topic you want us to talk about? Send us a message over on Facebook or Instagram. You can also reach us over at thehuntingwidowpodcast.com. There you can find all episode show notes, recipes, and reviews on women products. We can't wait to share our next episode, so stay tuned.